de Vries and I'm going to talk about Q-fever, the background. Simultaneously, it has been found in Montana, USA and in Queensland, Australia in the 1930s. In Australia there was Derek and he investigated outbreaks of undiagnosed illness in abattoir workers and gave it the name Q-fever. And in USA, they did some research on Rocky Mountain spotted fever and they collected Dermacenter and the Sunny ticks. And they isolated an infectious agent with properties not identified before. Well, there was a laboratory worker and who became infected with an undiagnosed isolated infectious agent, and it looked like the same illness as the abattoir workers in Australia. So a laboratory infection connected the two discoveries. Well, Coxiella burnetii, it's the bacteria who causes Q-fever. It's an obligate intercellular gram-negative bacterium. As you can see in the diagram, you can see it's closely related to Legionella. The transmission of Coxiella burnetii. Well, it's considered a biobug agent by its very low infectious dose and its high transmissibility. And it causes disease worldwide. It can infect a wide range of animal species like ticks, wildlife, birds, dogs, cats, domestic ruminants. And domestic ruminants are, I think, the most important reservoir for humans. The most important excretion route is during abortion from infected ruminants. There is a massive excretion of Coxiella burnetii and spread into the environment during this abortion. Also just birth products, well, feces, vaginal mucus, milk, urine, semen, also routes of excretion but poorly understood. The most common infection route is by aerosol, but also they found some infection route by oral uptake. By ruminants, the signs and symptoms can be asymptomatic mostly, but also abortion and stillbirth are common signs and symptoms. In humans, 60% is without clinical symptoms. The other 40% is acute by pneumonia, fever, headache, hepatitis. Well, not really 40% because 1 to 5% is chronic, non-specific fatigue fever, weight loss, endocarditis, night sweats, hepatosplenomegaly. Or you have an uncommon symptom by the post-Q-fever fatigue syndrome. It's prolonged fatigue, arthralgia, myalgia, blurred vision, and enlarged painful lymph nodes. Diagnosis can be immunohistochemistry or polymerase chain reaction, or CFT, ELISA, EFA. The groups of high risk are farmers, abattoir workers, dairymen, and others who work with livestock. Pregnant women are more susceptible to a chronic Q-fever infection, and the chance of getting an endocarditis is bigger in people who had already a severe cardiac disorder. The prevention strategies, well, you have vaccination of people, you do it in Australia, or you have vaccination of small ruminants like in the Netherlands. Other prevention strategies like hygiene, compulsory reporting, breeding ban, destruction. The case management is a Q-fever patient, first day of illness, under 90 days. There's a source research, an epidemiological analysis, and if they have the source of the Q-fever, there are additional measures, like listed before in prevention, hygiene. Nowadays, news sources are harder to find because the disease is becoming endemic. Thank you very much.